Hi everybody, welcome back to another lecture of OTVIJAY. Today we're going to be talking about physical agents modalities, and we're just going to focus on hot packs and cold packs, and next week we'll focus on ultrasound and electrical modalities. Sorry for the delay, it's just been really busy and hard for me to post content weekly, but starting next week I'm going to post more content. So the first modality we're going to be talking about is thermal modalities, and they can include hot packs, paraffin, and Pluto Therapy. Uh, Thermal modalities are actually very useful, especially if you want to improve stiffness, decrease pain, increase the range of motion, and accelerate the healing. And the reason for that being said is with hot packs, as you apply heat onto an area, you activate a process called vasodilation, which basically opens up the blood vessels so oxygen is delivered quicker. There's an increase in blood supply. There's an increase in metabolic reactions, which in turn increases circulation and improves healing of a chronic wound. Just remember that as the blood vessels open, more oxygen wants to come in. And with that being said, it also reduces muscle spasms and improves healing, right? And also decreases pain. And also, when you apply heat to an area, right, it relaxes the muscles, but also it starts to elongate the tissues. So the tissues become much more extensible, much more movable. I use hot packs for any of my patients who have that limited range of motion in their hand and in their wrist. And sometimes, if let's say they have just a radius fraction, they're really stiff in the fingers, I'll combine paraffin with hot packs. And we're actually going to be talking about the paraffin later today. So as you can see on the right, this is a picture of a hot pack. You want to put this in a hot pack cover. You want to wrap the hot pack cover in 6 to 8 layers of towels as to avoid burning the patient. Because remember, as you pull the hot pack out of the hydroculator, it's going to be very, very, very hot. So if you just put the hot pack with the cover on a patient, you may burn the patient. So we always want to wrap it around 6 to 8 layers of towels. So as we said, for the hot pack, generally used for muscle relaxation and pain management, it can go up to 1 centimeter in depth. Some of the advantages is that it's not deadening, it's freedom of limb positioning. It's fairly easy to apply, and you can combine this with stretching. However, with using hot packs, over time the hot packs do become cold, so it takes time to reheat it. Sometimes because of the shape of the hot pack, it may not always distribute heat evenly with patients who need it in, let's say, their fingers more than their hand. While you're putting on the hot pack, it's difficult to move the limb. So let's say you want to put a hot pack on the wrist, right? You're going to have to wait till the hot pack gets cold, and then you can move the wrist. You can't put the hot pack on the wrist itself and move it around because again the hot pack will fall and it's not ideal. So the next thermal modality we're going to be talking about is paraffin wax. So those who gone to a spa before know paraffin wax feels amazing. It's actually really good for the skin. It's a great skin lubricant. So with paraffin wax, it's tolerable heat. It's about 125 to 130 degrees Fahrenheit. And so paraffin wax has what's called a low specific heat, which basically means that it doesn't take long for it to heat up. It stays warm for a fairly short amount of time. And we usually use thermal modalities for, again, pain management and improving tissue extensibility. And what I like about paraffin wax is that I love using this on my patients with arthritis in the fingers and any of the finger conditions because, as you can see, paraffin wax is very focused, right? It really targets the fingers and in the hand itself. So you don't want to use this for fairly large areas, just preferably small areas, like again, your finger, your hand, and you can combine the paraffin wax with a hot pack. Right, so with paraffin wax, you want to be really careful. You can't use paraffin wax for everybody. For example, individuals with open wounds, those who don't have any sensation in their hands, and those who are recently burned, you definitely want to avoid using paraffin with them for the obvious reasons and for the precautions. And you also just want to be careful if they have fragile skin You don't want to make sure that they burn themselves, right? That in terms of their vascular compromise. And so with some advantages of using thermal modalities, it's a great skin lubricant like we talked about. And again, with paraffin wax, some of the advantages is the circumferential coverage of small joints, again, like your fingers. It can be combined with a hot pack. It's a great skin lubricant, and your upper extremity can be elevated. Some of the disadvantages with using paraffin wax is that the hand is static, the wax itself can be a little bit messy, and it's difficult to clean the unit. And it takes a fairly long time for the paraffin wax to heat up. So if you ever open up a new pack and you put it in, right, the paraffin wax, it takes about a day, or at least in my experience, it's taken a day for it to heat up. So we always put it at night, and then by tomorrow morning, it'll be good to go to use. And now we're going to be talking about phototherapy. Phototherapy is actually my favorite. So phototherapy transfers heat through convection. There's a ground corn substance that you use. It's corn husk in the Pluto machine itself. And what I love about phototherapy is that you can move your upper extremity in the actual machine itself, and phototherapy is a great sensory component. So actually, for all my patients who have the sensory issues, especially nerve conditions, who are feeling hypersensitive, and I like to use phototherapy to decrease that hypersensitivity, as well as use it for some of the other sensory conditions. So with thermal modalities, remember we talked about with thermal modalities, the metabolic processes actually increase because of vasodilation, right? And as the blood vessels open, circulation increases. Patients with, let's say, cancer or malignant tumor that is still active. So let's say patients with a blood clot forming or malignant tumor or cancer that is still active. You do not want to use thermal modalities with them because, again, you're going to increase that metabolic rate. You're going to increase that circulation. As more oxygen comes in, more circulation occurs. And you don't want that malignant tumor, cancer, thrombosis or infection to just travel around the body. You don't want that happening, so you want to avoid using thermal modalities. However, if you are using thermal modalities, you might want to look at the precautions and just be wary of it. For example, you want to be careful, especially if it's an acute injury, if a person is pregnant, there's impaired circulation, let's say there's edema, metal in the area, multiple sclerosis, impaired sensation. You want to be careful with all of that. But again, you really want to know your contraindications and your precautions because you don't want to increase that metabolic rate. Now let's talk about cryotherapy. Cryotherapy can be in the form of ice packs, cool sprays, or ice sticks. Now, cryotherapy uses cold as a therapeutic means, and it's great to reduce inflammation, pain, swelling, reduces spasticity. You can facilitate movement and control symptoms of multiple sclerosis. So with cryotherapy, you probably would be using this for more in the acute stages of an injury. And unlike thermal modalities, cryotherapy uses a process called vasoconstriction, which actually means that the blood vessels contract, they tighten, and decreases the rate of oxygen, right, going through, and decreases the metabolic rate, as well as the activity of cartilage degrading enzymes. You can also use Colpax for multiple sclerosis symptom management. And now with cryotherapy, if you apply for more than 20 minutes, there's something called a hunting response that occurs, which essentially is a process of alternating vasoconstriction and vasodilation in the extremities that are exposed to cold, right? And that is a response to pain. And finally, let's talk about the contraindications and precautions. Cryotherapy, we're going to avoid using it for patients who are hypersensitivity or intolerant to cold, something called cryoglobemia, which essentially is just these abnormal proteins in the blood which actually thicken in cold temperature, and something called PCH, which is paroxysmal cold hemoglobinuria. This is essentially a rare type of anemia. So with Raynaud's disease and phenomenon, there's actually this bluish, cold, pale color you usually see in your fingertips and in your hands, and this is a response to cold. So in Raynaud's disease, the symptoms are bilateral. So if you apply coldness to one hand, both hands end up becoming blue. And with Raynaud phenomenon, it's actually unilateral. So it's only one hand. So again, remember, with Raynaud disease, it's both hands, and with Raynaud phenomenon, it's one hand. And again, with over-regenerating peripheral nerves and circulatory compromise, you generally want to avoid using cryotherapy. And if you are using it, you want to be careful, you want to be cautious over using it on a superficial main branch, over an open wound. You also want to be careful with using it for individuals with poor sensation and impaired mentation, right? The mental ability to understand. And that is the end of today's lecture. It's actually very short and sweet and simple. I hope you found OTVIJAY's lecture on the first part of PAMS helpful. And next week we'll pick it up. And have a great day.